So working as a doctor in psychiatry, a big part of my job is literally just talking to people. It's not just prescribing medications, but it's just talking to people, educating people, and challenging common myths. I thought it'd probably be a good idea to make a video on this subject because there are a lot of myths that we come across in the field of medicine and in the field of mental illness and in psychiatry. And there are themes. There are some myths that are more common than others. So in this video, I wanted to kind of address the top 5 most common ones that I hear and talk a little bit about how I talk about them, how I educate around them. And I would be interested in hearing from you guys in the comments as well, if this is something you believed or if it's something you've had trouble with. If you're new here, a warm welcome. My name's Dr. Sill. I'm a junior doctor from Australia. I work as a doctor in the psychiatry training program, but I make all of these videos in my personal capacity. I'm not representing a medical college or a workplace. None of this content constitutes personalized medical advice. It's all general advice in nature, and no patient-doctor relationship is formed by engaging in this content, but I do love reading through your comments, so please consider commenting if there's something you want to share. With that out of the way, let's get into myth number 1. Myth number 1 is that mental illness equals weakness. This is a little bit more common in men from my experience, that there's this rigidity and avoidance and denial that there's something wrong happening, and that acknowledging pain, opening up, being vulnerable, these are all associated with being weak. The idea that mental illness and being vulnerable is a form of weakness is to an extent cultural. This is reinforced, and often the people who have these beliefs have had experiences in their childhood or in their early life where they were shamed or bullied or teased for being vulnerable, for expressing the need for help. And that carries on throughout life. And that pain of being persecuted in a way, being targeted, being bullied, being attacked, has meant that the way that they've managed pain, psychological pain, is not by admitting it. It's by denying it. It's by using a kind of inner strength to repress, suppress, or deny the kind of pain, the psychological pains that come up, anxiety and need for attachment and connection and all those things. But it's absolutely clear to me, and the evidence is clear, that if an emotion or a psychological issue is not explicitly addressed or processed in a helpful and therapeutic way, either with a loved one or a therapist or a caregiver, well, then it manifests in other, more subtle, more destructive ways. And these other ways that unaddressed emotions can manifest can be very sinister. It can look like just having a couple of extra beers, or putting yourself in a risky situation, having an affair, making bad decisions, acting out, getting really irritable and not knowing why you got so angry all of a sudden. There's a thing called catastrophic responses, which is when a little thing, something that doesn't seem that big a deal, like someone cutting you off in traffic, triggers a huge outburst of a reaction. And that's because it's not the little thing that is triggering the outburst. It's all the unacknowledged, baggage and cargo and trauma and neglect and lack of vulnerability and lack of processing, all this unconscious and unprocessed raw stuff that just gets eventually can't be denied any further, can't be contained any further, and pops. And people, can get very violent or get very depressed, or, it can trigger instability. So I would actually flip this on the reverse, that not acknowledging, well, I would say it this way, that acknowledging a mental illness, acknowledging vulnerability, being vulnerable is a sign of strength, not weakness, because it's hard. It's really hard. It's painful. That's why people deny their issues, because it's too painful to acknowledge. And so I would say the other way. It's not a weakness to have a mental illness, but it's a strength to address one's mental illness. I guess another big takeaway from here is there aren't, the longer you work in this field, actually it doesn't take that long working in this field where there aren't people with or without mental illnesses. This is a random definition with an arbitrary cutoff. I mean, not random, but arbitrary cutoff. So it's not people are crazy or not crazy, which is what I hear some people describe the world as. Rather, it's how crazy and in what way are they crazy. So I might look like a pretty normal functioning individual, but I've got things that, if you dig deep down enough into my psychology, you think I'm crazy. But that's okay. We're all a bit crazy, and it's not about not being crazy. That's not the goal. It's about understanding in what way we are odd and it's eccentric and what our needs are, and in what ways can that be unhelpful so that we address those unhelpful ways and improve the quality of our life so that we have a meaningful life. But absolutely not a weakness. All right, that's too much of a ramble. Let's go on to the next myth. Myth number 2 is that medication are the only option. And in fact, depending on the mental illness, therapy can be more effective than medications, or at least have longer lasting effects. So, look, when we talk about medications are the only option, that is a myth. The important thing to recognize here is that treatment plans are holistic. If you want to make a change, if you want things to change, you need to have a holistic approach to treatment plans. For some people, medications are essential. That's not a controversial statement. That's just the way it is, unfortunately. And, everyone wants to have a life without medications, but you don't get to choose the cards you're dealt. And if you've been dealt a bad hand or a tough hand and you've got a mental illness that's severe, that, you've tried off of medications and you've had risky things happen, and you're a psychiatrist and you have figured out that medications are the only way, then that's a shame. But it's true that medications are critical for some people. But there's so much more than just medications, and the majority of people with mental illnesses, medications aren't the major part of their illness. So if you think about illnesses like depression, anxiety, trauma, even obsessive compulsive disorder, big parts of these illnesses are the therapeutic component and the social component. Maintaining relationships, getting involved in groups and connection with others. So medications, depending on the severity of the illness, can be not even there. You can have absolutely you can have treatment plans without medications. Thinking of ADHD, for example, where a major part of the treatment is actually non-pharmacological, and it's undervalued and underdone. So we have a lot of ADHD being diagnosed at the moment, a lot of people who had not been diagnosed previously. We have very distractible social environments, like TikTok and going through these shorts that trigger issues in attention, and the solution seems to always be stimulants. But no, it's about a holistic approach to treatment plans. And a massive part of ADHD is the non-pharmacological things. It's about figuring out how you can work in a way that builds your attention skills and how you can protect sleep and personalized treatment plans. So I can't make generic statements, but it's all about personalized treatment plans. And the structure we follow is called biopsychosocial. So medications are the biological component, but the psychosocial, the psychological therapies, the social engagements, those are really important. And having cultural and religious and other aspects of the management plan are really good as well. All right, myth number 3. Mental illness, or people with mental illness, are violent and dangerous. Well, you see it kind of in the news. I guess we need to, whenever there's a stigmatizing commentary like this, you need to take a deep breath and realize that it's always more complicated than it seems. The first thing to say is that if you look at all mental illness, the majority of people are actually more likely to be victims of violence than perpetrators of it. And that that majority of mental illnesses are not associated with an increased risk of violence. A lot of perpetrators of violence, have issues in impulse control, who have issues might have psychopathic personality structure, which wouldn't be considered a severe mental illness, but rather a personality structure. And so, if you think along those lines, most people are likely to become victims of violence. There are people who have committed violent acts due to their mental illness. Okay, that happens. That's happened. If the mental illness is adequately treated, that doesn't happen, right? Because there are some very treatment resistant individuals, and those people will be in higher security settings than people who aren't. But adequately treated mental illness is not associated with an increase in risk. Often people who have been violent or, done acts of violence, they've been inadequately treated or weren't treated in the right environment, and or not assertively treated enough, and had done things. So if we're talking about severe mental illnesses like schizophrenia, there is a small increase in risk compared to the general population of being a perpetrator of violence, especially if it's untreated. But if it's treated, that risk is contained. All right, myth number 4. I feel like I'm on a game show host. Myth number 4, contestant number 4. This is that therapy is just talking. Why pay for that? Therapy. Very important component of a holistic treatment plan for someone with mental illness, and can be really helpful for someone who just wants to learn about themselves more deeply. Look, therapy exists on a spectrum of supportive kind of therapy, where it's not about exploring your unconscious defense mechanisms and how you relate to others. And supportive therapy and counseling is really around using your strengths to cope with stresses in your life. So, it's a strength-based supportive experience. And then there's a bit of a spectrum towards expressive or psychoanalytic therapies. That's the unconscious stuff. That's when you sit with a therapist, you do a lot of sessions over a long period of time, you explore your defense mechanisms that are unconscious. The therapist goes, oh, well, have you thought about this? And then, have you made this and that connection? And you kind of explore like, oh, maybe in my childhood I did, need to gain the approval of my parents, and that was hard, and so now I have a sensitivity to rejection, and I didn't realize that. And it's all unconscious kind of stuff that comes up, and you notice your ways of relating with others and with yourself and with the therapist. And that relationship with the therapist is very critical when you're doing expressive kind of psychotherapy, because you'll find the way that you relate to others comes up with your therapist. Are you kind of got an abandonment anxiety, so it's hard to end the sessions? Are you kind of avoidant and missing sessions? And so it's far more than just talking. There's a deep reflection and investigation that happens with those kind of therapies. And then there's all these therapies in the middle. There's CBT, ACT, schema, and they kind of exist on a spectrum, but they're more structured. They're less unconscious mechanisms-y, but more just looking at the way you think consciously and addressing unhelpful ways of thinking. And they all have different ways of doing that. The whole goal is to change the way that you think if it's unhelpful. And that is far more than just talking. And that's why you can't do it with a friend, right? You need to actually pay someone so that you can be boring, so that you can be vulnerable, so that you can be open, and so that you can depend on it. With a friend, there's so much bias, there's so much conflict. So a friend can be supportive, and can even be supportive in a kind of, you can talk to your friends about like weird unconscious stuff going on if you want, but you need a trained therapist to have the right dynamic between the two people. And so I'm a big proponent of therapy. I find a lot of people who I review who have a treatment-resistant illness have not done sufficient therapy to explore what's going on. And often when people find that medications aren't working for the depression, it's I shouldn't make too generic a statement, but it can be the case that they haven't done sufficient therapy to explore what's going on. So medications can't change the content of thought. They can reduce the emotions and intensity of the emotions associated with thoughts. But if you want to kind of address the content and the ways of thinking, that is best done through therapy. All right, guys, myth number 5, the final myth for this video. Talking about suicide increases the risk of it. No, it doesn't. It's, in fact, if anything, it's helpful. if it's done in the right way. You obviously don't want to encourage suicide or minimize or kind of be blasé about it. Suicide's a very serious subject, and a lot of people who have been thinking about it have been tormented over it. They don't. There's a lot of shame. There's a lot of conflicting emotions. There's part of them that see it as a solution to end the pain. That might be guilt associated with the effects it could have. All this builds up into someone, and actually, it's a really important thing to understand in making a risk assessment and understanding. Well, hang on, maybe this person is a higher risk than we thought. And so, a lot of people say if you discover that someone you knew died by suicide, feel like, couldn't see it coming. That does happen, of course, but talking about suicide is a way to kind of see it coming, I guess. Look, some people, when you ask about it, will be like, whoa, like me, what? No, of course not. And might even make you feel a bit uncomfortable for asking. Like, why would you ask that? But I think that it's better to be kind of like, it's better to have that experience than to not ask about it. So that's what I think. But, you can ask about suicide in gentle ways and just say, look, it sounds like you're going through a lot. Some people who are struggling like this can have thoughts of ending their life. Has that happened to you? And, kind of normalize it. And it's not that someone having thoughts of suicide needs a psychiatric review and needs an inpatient admission and It doesn't, you don't need to call the ambulance all the time. There's no one size fits all in psychiatry, but it can be a normal experience to think of ending one's life if you're going through a really painful experience, right? There is a lack of maturity in some of the discourse around suicide online, and it's this. A lot of people think of suicide, and it gives them a sense of, okay, well, there's a way out. But here's the thing: if someone's having a severe mental illness, if they're having very intense thoughts of suicide, if the suicide's the front of mind and not just something on the back of mind, if it's affecting their quality of life, if they're planning, if they've got things that they're planning to use to end their life, well then, all hands on deck. We've got to do something about it, because it is preventable in a lot of cases. Not always, right? I'm not going to make any big statements like we can stop all suicides, but we can reduce suicides, and we can, to me, it's not about stopping suicide. To me, it's about helping someone build a life that's worth living for them, getting recovery. And in that process, often the suicidal ideation will reduce. But there's lots of reasons why people end their life. And in all those reasons, just asking about suicide doesn't increase the risk. And if anything, it can reduce the risk and help elucidate the risk, help you realize what the level of risk is. So if someone's saying, it's time to go, I've got a rope, I'm going to go do it this afternoon, then that's a very different response than if it's just like, look, sometimes it comes up in my mind, but I wouldn't actually do it, and it's just it gives me a sense of relief because I'm in a really difficult position. I've got chronic pain, whatever it is, and I'm able to, have plans for the future. I'm able to continue living, but maybe I should see a therapist. Whatever. I'm just thinking out loud here. So that's basically, what I'd say about that. But are there any other myths you think that I should have included in this video? Leave it in the comment below, and I'll see you guys in the next video. Bye for now.